If your doctor tested your TSH and told you that your thyroid function is fine, they may have missed some critical clues that would give you insight into why you could be suffering from things like weight gain and fatigue and mood changes. The purpose of this video is to explain that there are actually 5 critical thyroid studies that need to be obtained to create a complete picture of what is going on not only in your thyroid gland, but at your cellular level as well. So by the end of this video, you're going to have some good tools to understand the exact studies that you need and what they mean in the big picture. My name is Scott Resnick. I'm a medical doctor with 30 years of experience, and I'm making these videos to help you guys to clarify complex scientific subjects so you can turn around your health and live a life free of drugs with longevity and clear thinking. And today we are talking about the thyroid gland. Now, I'm not going to diss on the TSH. I mean, actually, this is a really good place to start. Remember, TSH stands for thyroid stimulating hormone. And what this is it's a signaling hormone that's released from the hypothalamus and the pituitary in the brain, which is then delivered to the thyroid gland. And basically what it does is it instructs the thyroid gland to make either more or less thyroid hormone. And it works by what's known as a negative feedback loop. And what this means is that if your thyroid gland is slacking and making less thyroid hormone, the TSH goes up. And what happens is after the thyroid gland has arrived at an appropriate amount of thyroid hormone, if all systems are working well, then what happens is the secretion of TSH goes down and your thyroid gland starts in response to make less thyroid hormone. This is a classic negative feedback loop, which is seen in so many different factors of human biology. So TSH is a great place to start. The important thing to remember is twofold. The first is that the TSH tells you nothing about what is going on at the cellular level. And there are so many people out there that actually have a normal TSH, but when we begin to measure the free active hormones, which we are going to cover in just a moment, they find out that in spite of a normal TSH, they are still in a relatively hypothyroid state. And I can tell you from my clinical practice that there are thousands and thousands of people out there who have been told by their doctors that their thyroid is normal when they are just screaming hypothyroidism, and so many of their symptoms get resolved by optimizing their thyroid health. Now, the typical range of thyroid hormone is typically 0.5 to 5, and so many people are told that their TSH of 3 is normal. But based on my experience, I can tell you guys that an optimal TSH is typically between about 0.5 and 1.5, and there are so many people who do well when we modify their treatments to establish a TSH in this range. Now, the second most important hormone that you need to be thinking about is the free T3. And were I only to have one thyroid study that I could obtain, I would obtain a free T3. Remember, there are 2 thyroid hormones, T4 and T3. And T4 is an inactive hormone which has to be converted to T3, which is the active hormone. Most people do really well when their free T3 is in the upper half to upper third of the laboratory's range, almost irrespective of the TSH and the T4. And one more thing, as we're talking about these hormones, T4 and T3, I'm recommending that you all obtain what is known as a free T4 and a free T3 marker. Because what happens is thyroid hormone is bound to carrier proteins in the body, notably thyroid binding globulin, or TBG. This is important because if you measure your total T3 and it's in the upper half to upper third of the range, but you've got excessive globulins or proteins floating around in your bloodstream, the free and active component of the T3 may not be available to activate the cells. So the first most important thyroid study is probably the free T3, because as we see this in the upper half to the upper third of the range, people's lights seem to come on and they seem to do better. Now, the next and third hormone that's so important to check is the T4. And again, I'm recommending that you check the free T4 and not total T4 for the exact same reasons that I mentioned for free T3. The important thing to recall here is that T4 is what's known as a prohormone. It effectively has no activity at the cellular level, and it needs to be converted into T3 by what are known as deiodinases. Now these reside in the cell. And remember, T4 and T3 go to the nucleus of the cell, as a steroid hormone does, and they tell the DNA in your cell to either increase or decrease your metabolism. And as we move towards a lower overall metabolism, all those symptoms that I described in the first minute of this video become more prominent. So now we've talked about checking a TSH, a free T3, and a free T4, remembering that T4 needs to be converted into its active form, which is T3. The next study that I recommend that many of you consider would be what's known as a reverse T3. Now what happens is T4 refers to a tyrosine amino acid with 4 iodine molecules bound to its shell, thus the T4. So what happens is, as one of these iodine molecules, atoms, is deiodinated from the T4 molecule, you get a T3. But what happens is, when we are in states of inflammation, stress, starvation, things that would want us to move to a lower metabolic state, what happens is in the cell, our body deiodinizes a different iodine atom. So what happens is that free T3 and reverse T3 are basically the same molecule, but they've had a different iodine molecule removed. And the reverse T3 blocks the activity of the free T3. It's kind of like the evil twin of the T3 molecule. So now we have 4 studies that you need to be checking: the TSH, the free T3, the free T4, and the reverse T3. And the last thing that I recommend for all of you, if you really want to know what's going on with your thyroid gland, is to obtain a marker looking for Hashimoto's thyroiditis. Now, there are 2 markers. There are the TPO antibody, which stands for thyroid peroxidase, and the anti-TG antibody, which is antithyroglobulin. What happens in Hashimoto's thyroiditis is our body begins to make antibodies against the thyroid gland. And while the first presentation of Hashimoto's is paradoxically a hyperthyroid state, most of the time, most people don't catch this inflammatory process in this early inflammatory state. And all we're left with is a state where these antibodies and subsequently our immune system create an inflammatory response in the thyroid gland that starts to destroy the thyroid cells that make thyroid hormone. Now, this is not uncommon. I mean, it's estimated that something like 1 in 8 to maybe 1 in 7 Americans have antibodies against their own thyroid gland, thus promoting almost an epidemic of hypothyroidism. So it's really important that you or your doctor check a TPO and a TG antibody at least once in your life. And if you are experiencing progressive symptoms like the ones I mentioned in the first part of the video, check it at least once a year. Now, the important thing to remember is that the thyroid gland is part of a bigger picture. And in subsequent videos, I'll be introducing a strategy that I've used with my patients for the last 15 years, which is the systems health pyramid. And what this is it's a way of deconstructing how the body works into a set of actionable and discrete symptoms. And what you'll find is that as we go over this systems health pyramid, that the thyroid gland with the other energetic hormones is well situated in the second strata of the health systems pyramid. And what happens is, as we begin to stack the different components of the pyramid on top of one another, we can then increase the complexity of systems such that our higher order symptoms, things like cognition and reproduction and cardiovascular health, work optimally. So in this diagram, I'm showing you that the foundation of the health systems pyramid is simply nutrition. And I'm not talking about diets. I'm talking about the actual nutrients that our body requires to run all of our metabolic pathways. So once we've established good nutrition, and this refers to both micronutrients, things like vitamins and minerals and phytonutrients, as well as the macronutrients, proteins, carbohydrates, and fats. But once we have established these, then we can begin to conduct the machinery that manages our metabolic energy, which is the second strata of the health systems pyramid. It's important to recall that there are 3 hormones that work in concert in this second layer to help to maintain energy in the body. And these are insulin and cortisol and thyroid. And in subsequent videos, I'm going to get into these a little more further. But the important thing to remember is that thyroid is kind of like our It's kind of like our thermostat of our body. I mean, when times are good, the stress is low, there's plenty of food, we can run at a normal thyroid rate. But when we're starving, when we're stressed, when we're infected, and when we are inflamed, our body moves to a hypothyroid state by decreasing the TSH going to the thyroid gland, by decreasing the production of T4, by decreasing the conversion of T4 to T3, and, it should be no surprise, increasing the conversion of T4 to reverse T3. So there you have it. Those are the 5 hormones that you need to obtain to really have a full comprehensive understanding of your thyroid function. But if you guys want to know where you stand from the disease to health spectrum from a functional perspective, I've put together a really simple 2-minute self-assessment that you can access in the description below this video that's going to give you some insight where you stand on this spectrum of health. As always, this is YouTube, so be sure to like, comment, subscribe, because it helps me to make better videos and help you guys to understand your bodies and what you need to do to live well and live long. And as always, take care.